Hola, buenos días, buenas tardes, dependiendo el uso horario. Bienvenida, bienvenido.
Hello and good day, good morning, good afternoon. Welcome all. Bear in mind that we have interpretation into English, Spanish, and Portuguese. I've already been introduced. I am Ignacio Astorga. I'll be the moderator for this session. This PPP Congress session is focused on the comparison of a study contracted by the bank where we compare the development of service provision in PPP contracts versus public investment. What was contracted? There was a contest in the PPP network in 2021. We have the next presentation, and next we're going to have a discussion about the experiences in Latin America, Europe, and Italy regarding this type of approach. To present this work, I'd like to invite Jose Manuel Basayo. He is an engineer, road engineer from the Politecnica University of Madrid, and also an economist from the UNEP. He holds a tenure in this subject in the same university. He's also a researcher in economy and infrastructure financing. I'd also like to introduce Maria de los Ángeles Baeza, doctor in economy and law graduate. He is currently a professor in financial economy and accounting school of the University of Granada, and also collaborates in the transportation center. Her work during the past years has been focused mainly on regulation and economic and financial viability of these types of concessions. So I invite you all both to start your presentation. You have 15 minutes. Thank you. Thank you very much, Ignacio. First of all, I'm going to share the screen.
¿Me pueden confirmar que se ve correctamente?
Could you please confirm that you can see my screen? Yes, we can see it. Very well. Thank you very much to the Red APP from the IDB for giving us this opportunity to present on such a passionate work, which is a comparison of performance in the provision of contracts for services, PPP, versus public management, or what we know as OPT. The work has been conducted with a team of researchers from the Politecnica de Madrid University and Granada University. We've been years working in the realm of PPPs in Latin America as well as in other countries of the world. This is the content of our work. I'll briefly move on to tell you the goal. The goal is to compare and, if possible, measure the performance in the provision of public services through PPP and traditional public works, or OPT. In the realm of PPPs, the majority of the studies have been focused on the costs and efficiency, but not so much on the level of service provided by either party. The idea is that based on a series of case studies, to provide options to Latin American governments on performance. For this, we've gathered international experiences for our theoretical framework using bibliography and sources, and also PPP guides from the different countries, various countries. And upon doing this, we decided to study 4 case studies. Given the importance gained in Latin America by social infrastructure, we decided to go more in depth to the water and sanitation and health sectors. And we took on case studies in Colombia for health, Chile for health as well, and water and sanitation, and Peru for only
llegamos a la conclusión de que la calidad del
sanitation.
servicio no puede separarse de los
Regarding
costes o de los
the
precios a la hora de
conceptual
determinar el
framework,
bienestar
we
social.
reached the conclusion that
La
the quality of
calidad
the
es clave
service
si queremos
is
un desarrollo sostenible. Y
closely
además el
related
derecho de los
to social
consumidores.
welfare. It is
Tenemos
key if
derecho a
we want
saber
sustainable,
qué calidad de servicio nos
and
están dando.
it is also a right of
Los
the
gobiernos
consumers.
pueden
We have the
adoptar
right to
criterios
know
para
what
medir esa
quality, what level
calidad
of quality of the
a
service
través
we're
de
receiving. Governments can adopt
indicadores.
criteria to measure
Y
that
esos
quality through
indicadores nos sirven
indicators,
a su vez
and
como
these
estímulos de
indicators
incrementar la transparencia
serve
y de
in turn
proporcionar
as a
información
means to increase
histórica que nos
transparency and to
ayude a
provide
mejorar la
historical
gestión.
information
Además, esos
that will
indicadores se
help
pueden
improve
incorporar en los
the
contratos
work.
para alinear el interés
Apart
privado
from
con el interés
these,
social y público,
apart
de
from
tal
this, these
manera
indicators
que
can be included
el
in
sector
the
privado
contracts to
trabaje en mejorar
address
los indicadores en
public
su beneficio y a la vez en el beneficio de todos.
well-being, so that the social
La
side
motivación
work
de
in
este
this indicator
trabajo es que
for
sí es
their own benefit
importante
as well as for the benefit
diferenciar
of the
entre
society as a whole.
APP y gestión pública
There are various
tradicional.
differences
Y la idea
between
es
PPP
estudiar
and
qué
traditional
diferencias hay y
public
sacar conclusiones.
work.
Bueno, de la
And
historia
the
de la
idea
experiencia
is to study the
internacional, lo que
differences and
llegamos a
to
la
draw
conclusión es
conclusions.
de que
In terms of international
acertamos tanto el
experience,
BID
in
como
this study, we
nosotros a la
reached
hora
the
de definir ese
conclusion
estudio,
that
porque hay una
both the
escasez
IDB
de
as well
número de
as
estudios
us,
científicos que
we
comparen
were right
el
when we
ritmo que
defined the
hay
study because
de
there's it was the right idea because
Las razones son
we
varias.
lack
La primera, la dificultad de
studies in
determinar
this
el
area, in this
efecto
comparison of
actual de la
PPP
APP.
and
Sabemos,
public
podemos
works.
determinar la calidad
The
de la
main
APP,
reasons
pero es
was to
difícil
determine
evaluar cuál hubiera sido la de OPT.
the
Por
contractual
otro lado, existe una
quality
falta de información
of
muy
these
grande
PPP
en
contracts
proyectos de
of
gestión
both,
pública
and there's
convencional o
also a
PPP,
very severe lack of
y en
information
algunos
in
casos los modelos
conventional public
contractuales
works
OPT son muy diversos, por lo
and
tanto es
PPP
difícil de
projects, and in
generalizar.
many cases,
Lo que
the
hemos visto es que en la
contractual models are quite
literatura pues
diverse,
hay
therefore it is
varios
difficult to
enfoques
generalize. What
empleados
we
para
have
hacer
seen is that
dichas
in the
comparativas.
literature, there
En
are
algunos
various
casos
approaches
se define
employed
un
to
caso de
carry out those
negocio ex
comparisons.
ante
In
para el
some
proyecto
cases,
sobre la base del cual se evalúa esa
there's
calidad.
a ex
En otros
ante
casos se
business
adaptan los
case
comparadores público-privados
stated at the
y
beginning based
finalmente
on which you
los
measure the
estudios más
qualities, and
empíricos
others
lo
you
que hacen
compare
es
public and private
hacer una valoración el
comparatives.
desempeño
And
de la
also the more
APP
empirical
con otros
studies, what they do
proyectos
is to
similares que se
assess the
están
performance of the
gestionando a
PPP with
través
other
de
similar
fondos.
projects that were being developed
Esta
via traditional
diapositiva de aquí, lo que ven ustedes es una
public
recopilación
means.
de algunos estudios de la
This slide
literatura
here, what you can
internacional,
see
que
is
lo
a
que hacen es
collection
una
of
comparación del
several
desempeño en
studies
APP.
from international literature,
Empezar
which
comentándoles que
compare
en los ámbitos en que
the
estamos trabajando los
performance
estudios
in
son
PPP
prácticamente
projects. I'd like to start
inexistentes.
by saying
Sí
that
que hay en otros
in the
ámbitos,
areas where we are
fundamentalmente en el
working,
ámbito
studies
de
are
las escuelas, en el
non-existent
ámbito también de las
mainly.
carreteras, y
There
la
are
conclusión
some
global
in
es
the
que
topic of schools, also
hay
for roads, but the global
en general, la
conclusion
mayoría de
is
los
that
estudios concluyen que la
in
prestación de los servicios
general, the majority
mediante
of the
APP
studies
es mejor
conclude that the
que la de
provision of
obra pública
services
tradicional.
via
En algunos
PPP
casos
is
es
better
prácticamente
than
similar, en otros
uh,
estudios hay algunos
through traditional
indicadores
public
en los
works. In some
cuales lo
cases,
hace
it's
mejor la APP
better than traditional. In
y en
some
otros
other
mejor
studies, there are some
los
indicators
proyectos
where
de tipo
the
OPT
PPP does
y en
better.
algunos de
In some
ellos
other
la
studies,
mayoría de los indicadores
OPT
evaluados
projects do
son
better. And in
mejores
some of
que en el
them,
caso de
most
la
of the
APP. Así se
indicators
observa que en
assessed
general
were better
la mayoría
in the case
de
of
los
PPPs.
estudios
Here we can
llegan
observe
a la
that in
conclusión de que
general,
las APPs ofrecen
the
un
majority of the
mejor
studies
servicio, ¿no? Otro de los problemas que detectamos en la
reach the
experiencia
conclusion that
internacional
PPPs
fue que
offer
los
better
estudios se
services.
centran
Another
en muchos
of
casos en una
the
o dos
problem that we
variables y no dan un
came
horizonte
across is that
amplio.
studies
Y en
are
algunos
focused in
casos
only one or two
detectan
variables in many
aspectos
cases,
que
and they don't
mediante
provide
APP
a
generan mayor
complete
calidad y en otros casos
view. And in some
o
cases,
para distintos
they,
indicadores determinan que la OPT
for
presta
different
servicios
indicators, they
más adecuados.
determine that the
Bueno, dicho esto,
traditional
pues vamos
public
a comenzar
works, they
a
provide more
mostrarles
adequate
las conclusiones que
services.
sacamos
Now,
del
having
análisis de
said
los
this,
4 casos de estudio.
let's see
Yo
the
presentaré
conclusions
los
drawn
casos de
from the
estudio
analysis
de
of 4
salud
case studies.
y posteriormente mi compañera María
I
Ángeles
will
Baeza de
be
la Universidad de Granada
introducing
hablará de los casos de
healthcare
agua. Terminaré
case
finalmente la
studies, and
exposición
then
yo con
Maria de
las
Los Angeles
principales
Baeza will talk
recomendaciones y
about
líneas de trabajo
water
futuras que planteamos
utilities,
para
and we
América
will
Latina.
complete our presentation
Bueno, el
with main
sector de salud en Chile es
recommendations that for
especialmente
Latin America.
interesante debido a que existen 3 modelos
So
de
the healthcare
gestión, los
sector in
hospitales
Chile is
privados, los
particularly interesting
hospitales
because
en
we have 3
concesión.
different management
La
systems. So
concesión
we have
incluye
private
tanto la construcción
hospitals,
como 15
then we
años
have
de
concessioned
operación
hospitals that
y luego
includes
los
both the
hospitales
construction and 15
sectoriales
years
de
of
gestión
operation,
pública. En el caso de los
and
hospitales en
and the
concesión,
public
se
hospitals.
puede puede afirmar que se trata de
In
un
case of
modelo de
concession
baja
hospitals,
gris
we can say that this is a gray coat operation because it is non-clinical services, and the operation and maintenance are provided by the owner of the concession, and the clinical services are provided by the public health services of Chile. And those services that are provided by the private sector are provided by them, but these are very specific contracts under a very short term. In the case of clinical services and maintenance that is carried out by the private entities are managed by public service. But in the healthcare services in Chile, there have been 3 waves of hospitals, so to speak. One in 2009, another one in 2013, and another one that will be launched in 2023 and 2026. One of the large problems that we have faced when comparing this information is that we have very little information regarding public hospitals. So we have studied the calls for proposals and the tender bids and the concessions that they have with the private hospitals. So we use the information on the hospitals in Santiago just to look at what is the level of performance that is requested from the private partners. And in short, what we can say is that in the case of PPPs, service levels are established in terms of indicators, and in traditional public hospitals, no indicators are defined. In PPPs, they have scheduled and non-scheduled activities, and there are times to go back to operation, and they have special provisions for that. And in the traditional scheme, the levels of demand are varied. As for monitoring, monitoring is permanent and digitized, and in traditional hospitals it is periodical, and there are positive incentives and fines linked to lack of performance in the PPPs, while in traditional hospitals there are fines linked to performance alone. So there are large differences in terms of what is demanded in one scheme and another. Another thing that we wanted to do was to compare not only the services, but the actual effectiveness of the service that is provided. And this was complicated for 2 reasons. It was impossible to compare both the sectorial or public hospitals, and we were unable to carry out any comparison because there was no information available. On the other hand, we tried to contact other public hospitals, and it was impossible to meet with them to have a qualitative view of what happened. And the main conclusion is that the performance in PPPs is more, in PPP hospitals is much more transparent. Service is reasonably good. User satisfaction is measured in surveys, and there is permanent monitoring. And shortly, I would like to explain the case of Colombia. In Colombia, PPPs are not yet fully operational. Contracts have just been executed, but the scheme is not fully operational yet. So we have looked at the demands only. So public hospitals in Colombia have a certain specific traits, and problems have been detected, such as lack of maintenance of the infrastructure and the equipment due to lack of funding. Right now, they are building a Hospital de Bosa in Bogota under a PPP. They are launching different hospitals a hybrid model and a traditional model. So in a few years, this will be a fantastic laboratory for the comparison. So in 5 or 6 years, perhaps I would like to go back to make this comparison. And the BOSA hospital does not include providing health services. It's similar to the Chilean model. So they have a concession for 18 years, and they have to provide performance indicators. What is the difference that we've seen in this comparison? Well, the PPP hospital has performance indicators that are inexistent in the traditional hospitals, similar to Chile. In the case of PPPs, there are deductions in the event of non-performance and no non-performance penalties in traditional hospitals. There are surveillance and control officers in both hospitals, and if there are any failures in operation and maintenance, they are controlled, and there is no control or no record of failures in PPTs in the traditional model. So PPPs are more controlled, and they provide a lot more information that helps the management. And María de los Ángeles Baeza will be introducing the case of waters and sanitation in Chile.
Como dice mi compañero José Manuel, yo voy a
as José Manuel has said, I'm going to go over the results that we have had after analyzing the sector for water and sanitation in Chile and in Peru. So starting with the water and sanitation sector in Chile, we must say that first off, we need to differentiate 3 models for management in the urban areas, and none of them is properly a public-private partnership. So at the beginning of the 90s, we opted for privatizing, which meant that the coverage for water, potable water and sewer systems would increase. Then we decided to move for a concession model to 30 years, and that would allow for privatization models to be limited to 30 years and not unlimited as we had it at the end of the 90s. And then finally, we have the public management system. So the Chilean regulations apply to all 3 management models for this service. In regards to the supervision of water and sewage systems, this is done by the superintendents of sanitary systems or services, and it applies to all 3 management models. This superintendence does not apply any incentives regarded to the compliance with the quality of service. Nonetheless, it can apply sanctions in the event that there is lack of compliance. In this study, we have analyzed the main indicators for quality and their indicators for 2020, and we have considered 30 companies that render services in the urban areas. 24 of those are concessions, 4 are privatizations, and 2 are public management. The main indicators that we have considered for assessing the quality of the service have been, on one hand, the quality of the water, continuity of the service, and the pressure of water. Also, the quality of served water and the quality of treated waters, the continuity of the gathering of this waters that have been treated, and finally, the delivery of service. So when we do the analysis, we need to see that when we compare the different models, it's not easy to do that comparison because of the specific differences between the models and due to the very few companies that are under the public management model. As I said, this statistical analysis has been done with charts, as you can see in this slide, where we have only shown the results for 3 out of the 10 or 7 indicators that we mentioned previously. So on the left-hand side, in that picture, you'll see that the companies that have accomplished full fulfillment of the sampling and quality requirements are 3, the concessions. Nonetheless, you can see that some of the companies that have had the worst performance are also concessions. And on the other hand, the percentage, the compliance percentage of the companies are above the average for concessions and privatized company. And so for this indicator, what we have concluded is that there is no clear differentiation in terms of the performance of the or delivery of service based on the management model. On the picture in the middle, we can see that the companies that have complied fully with the continuity of sewer services have been the concession companies, concessionaires, and the ones that have had this are the ones in the model of public management. And finally, in the right-hand chart, what it shows is that the only company that has attained full compliance of these indicators regarding the response to claims is a concession company, but it's a concession company that has the worst figure or value for this one indicator. So these indicators have not allowed us to conclude substantially anything regarding the performance of the services in the particular case of water and sanitation in Chile. We're now moving on to analyzing the sector for water and sanitation in Peru. So here, this sector shows the following characteristics. First off, all the companies providing services are public companies. So that means the rates are controlled by the government. And that, together with the social reluctancy to have an increase in the rates, means that even though the regulations say that the service providers should address all of their revenue for maintenance of the infrastructures, but the cost, the financial and just assume the financial cost for the services rendered, the truth is that these rates only cover operations and maintenance. So that means operations are really subsidized by the national government. I'm sorry, we are running short on time. Could you please make sure that we have enough time for Q&A? It's a very interesting presentation, but we need to make sure that we have time for Q&A. So the concession contracts are for specific infrastructures like water treatment plants, and that service is being rendered to those companies that actually render the services and not for the final user. Now, regarding the quality level for the service, under the private-public partnership model, there's the technical study that has been approved, that has to be approved, given by the company that wants a concession, and needs to be approved. And in the other model for public management, it has to be approved every 5 years by the superintendents. So we cannot have a comparable conclusion based on this, because the quality of service in regards to the
se establece que es de 24 horas,
the continuity
24
for
horas al
water
día,
production
mientras que en el caso de
under
gestión
the
pública
PPP model
ese indicador
is
se
for
mide como
24
la
hours a
cantidad de
day,
horas que el
whereas in the
usuario
public
final
management
va a
system,
recibir
that
ese agua,
same
lo cual
indicator
depende de cómo el
is
operador
considered
gestione la
as
oferta
the
y la demanda, es decir, que
continuity
en
of the
este
water
último
service
modelo
received by the
se le da
final
más
user.
prioridad a la
So in this
cobertura
last
que a lo
model,
que es la
we
calidad del
have
servicio.
given more priority to the coverage as opposed to the
En las
quality of
entrevistas que hemos
service.
mantenido para este caso de estudio,
Now,
se
in
nos
the
comentó
interviews that we
también
have had
que
with,
cuando
in terms of this
las
case
SUNAS,
study,
la
we were
superintendencia
told
detecta un problema en
that
el servicio prestado por las empresas,
when the
no suele
superintendent
imponer
finds that there
sanciones
is
pecuniarias
a
porque al
problem
final esas sanciones lo
with
que hacen es
the
afectar a la
companies,
capacidad
they do not
financiera de las
penalize the
propias
companies,
empresas
because in
para
the end,
seguir
these
operando, lo
sanctions, what
cual
they will do
repercute
is they will
negativamente en
affect
los
the
propios usuarios. Y es por ese motivo por
finances
lo
of the
que el
company, which
proceso
will in
sancionador
the end
suele
affect the end
finalizar
users
simplemente con una
themselves.
amonestación escrita.
So
Por
that's
el
why
contrario, en los
the
contratos de proyectos
sanctioning
desarrollados
bodies
mediante
usually should give
APP,
them
sí existen importantes consecuencias
uh,
pecuniarias en
something in
caso
writing,
de
but not
incumplimiento.
really fine them.
Bueno, ya paso a mi compañero José Manuel para
Under
que
the
él
PPP
concluya.
model,
Sí.
there are
Muchísimas gracias. ¿Me escuchan? Vamos, ya
financial
un minuto
penalties.
para decir las
Yes, thank you very
recomendaciones.
much.
Y las
We
recomendaciones
have
son
1
muy
minute for
sencillas.
the
La primera es que
recommendations, and the
los estándares
recommendations
de
are
desempeño y
very simple. The
periodicidad
first one
deben ser
is
semejantes en
that
servicios de
the
similares
performance
características. No
and
tiene sentido
periodicity
una
standards
infraestructura que presta un
of
servicio
their
similar
measure
tenga unos
should be
estándares diferentes
similar
sencillamente por el modelo
for
de contratación que tiene.
services that have
Lo mismo
similar
con la exigencia de los
characteristics. It
niveles de
doesn't make
desempeño.
sense to
No
have
parece que tenga
different
mucho sentido que el gobierno acepte
standards,
niveles de
because
desempeño
the
mejores en
model
APPs
for
que en
contracting the
OPC
service
para
is different.
infraestructuras que dan
Also,
servicios similares.
uh,
Lo
the
mismo en cuanto al control y la
demand for
supervisión,
performance levels
que
should
solo
be the same all
depende
across all
del
services.
tipo de servicio que
Same
se
for control and
supervisa.
supervision. They should
Finalmente, cuando
only
la
depend
gestión
not only
pública
on the
se
type of
preste el
service that
servicio
is
en
being
contratos
supervised,
externos de corto plazo o outsourcing,
should
se deben incluir
depend
también
only on the
penalizaciones
type
por
of service that is
incumplimientos similares a los
supervised,
aplicados en
not on the
APP.
type of
Lo que hemos
model that is
visto
used.
en algunos
And
casos en el
also
sector
that
público no
for
existen
the
penalizaciones tan
outsourcing
claras, ¿no? Y
contracts
finalmente, y yo creo que es muy
must
importante,
include
los niveles de desempeño reales deben
sanctions
medirse y darse a
due to
conocer
lack
a
of
la sociedad,
compliance,
tanto en el
same as
modelo
they are
APP
applied
como en el
on
de
the PPP
gestión
model
pública.
contracts,
Y
and that
finalmente,
the
pues
levels
quería
of
decirles una breve hoja de
performance
ruta. Creo que es
must be
necesario para
considered the same all
implementar estas
across. And
medidas, en primer
finally,
lugar, aprobar una ley de calidad de los
I
servicios
believe that to
públicos que
implement these
garantice
laws, it is necessary
transparencia,
to
periodicidad en la medición de indicadores y
approve
umbrales mínimos a
a
exigir
law or sanction
para
a
los
law
servicios con
for the
independencia de su
quality
modelo de contratación.
of public
Es importante
utilities
también
or utilities
categorizar los
that will
servicios
ensure transparency,
públicos de
periodicity,
tal manera
and
que
the
se les
measuring
pueda
of the
exigir una
indicators
un
and
nivel de
minimum
desempeño común,
thresholds.
¿no?
Also
No es lo
establish
mismo un
different
hospital grande que uno pequeño, no es lo
categories
mismo un
of
servicio de agua en zonas
utilities
urbanas que
that
rurales,
should
etcétera. Por eso se
have
puede
a
establecer una
common
categoría de
performance
servicios a
level
los cuales se les debe
um,
exigir
based on the
una
type of
calidad mayor.
service and whether it's being
Luego,
developed in
consideramos que es
the
necesario crear
rural
un
or urban
organismo
areas.
regulador
Then we
independiente de la
believe that it's
administración que
necessary to
presta o del gobierno
create
que presta sus
a
servicios que mida
regulatory
los niveles
body
de
which should be
desempeño
independent
tanto para los
from the
servicios de APP como de
government
OPC,
that
de una
will
manera
measure
neutra,
the
independiente
performance
del gobierno que presta los
levels
servicios.
for the
Y
APP
finalmente,
and the
creemos que toda la
other
experiencia
models.
que saldrá
And
acumulada de la
finally,
información que se
we believe
obtenga
that
se
all
podrá
the experience
incorporar
that
en
has been
guías de value
gathered
for
by the
money,
information
permitirá incluir criterios de desempeño en
um,
guías de value for money.
should be put together
Muchísimas
in
gracias.
guides that
Ahora
are
nos alarga
value
un
for
pelín
money.
más, pero creo que
So
merecía la
thank
pena
you
porque el
all.
estudio lo merece. Y
I
espero que
I
haberles
believe
animado para
that
que
we
lo
went a
lean.
little bit over our
Es un
time, but
poco
I think
largo,
it's
son
worth
ciento
it.
y
And
pico
I hope
páginas,
that
pero tiene un
you are now
resumen
encouraged to
ejecutivo
look at this
de
in
3
detail.
páginas
It's a little bit
que les aconsejo leer.
it's
Muchísimas gracias.
55 or 51 pages long,
Muchísimas
but
gracias,
it's
José
really
Manuel
interesting. So I
y María de
advise
los
you
Ángeles.
to
Yo creo que
read that if
es
you
un
can. Thank
estudio
you, Jose
que
Manuel.
efectivamente
Jose Manuel and Maria
es
Los
señero
Angeles.
respecto a
I believe that this
incorporar el
study
análisis de la parte operacional de los
is
contratos. Ya
definitely key
abre toda una nueva
in
ventana.
terms of
Tenemos varias
integrating the
preguntas y respecto a la
part
presentación,
of
les
the
comento que
oversight
el video de este va a
and
estar
the
cargado en la web. ¿Ya?
performance indicators.
La
Um,
publicación todavía está en
the video
preparación, pero
for
después
this
será
will be
pública.
uploaded onto our
Se le
website. The
informará. La
publication
PPT no
will
se va a
be made
compartir de forma
public,
directa.
and
¿Ya?
so
Quiero pasar a la sección de los
the
paneles y Paso a presentar a los
PPP
colegas que nos acompañan.
information will
En
not
primer
be
lugar,
shared
a
directly.
don
I would
Ernesto
like
López
to welcome all of our
Mariovich.
colleagues that are joining
Él
us
es
today.
director
Mr.
de la
Ernesto
Dirección General de
López
Políticas de Promoción de
Mariovich, he
Inversión
is the
Privada
director
del
of the
Ministerio de Economía y Finanzas del Perú y es miembro del
Directorate for
directorio del
General
Fondo de Mi
Policies
Vivienda
and
Sociedad Anónima.
Promotion of Private
Cuenta con amplia experiencia en el
Investment
sector
of
público,
the
en
Ministry
áreas
of
tales como
Economy in
salud,
Peru.
transporte,
He
fomento
has a lot
productivo,
of experience
economía,
in the
recaudación
public sector
tributaria
with
y
transportation,
gobiernos
health,
locales. Es bachiller en
economy,
economía de
and
la Pontificia
tax
Universidad
revenue
Católica del
and
Perú,
local governments.
con
He
maestría
has
en
a
Administración de Política
bachelor's
Económica de la
degree
Universidad de Columbia
in economy
y
from the
adicionalmente tiene
University of
especialización en
Purdue,
gestión
and he
pública
also has
y
a
derecho en
master's
competencia y propiedad
in
intelectual.
economic policy and
Presento
for
también a Verónica
public
Becchi.
policy,
Ella es profesora
law,
asociada en la
and
Cátedra de Gobierno, Salud de la Escuela de
intellect.
Gestión de la Universidad de Bocconi en Italia. Asimismo, es
Now we'll
profesora de
introduce
inversión de
Veronica
largo plazo
Vecchi.
en
She's
PPPs
a
y
professor
en
at the
cofinanciera de la misma
Bocconi
universidad.
University School
Sus
of
áreas de
Management.
especialización incluyen gestión pública,
Um, Her
asociaciones
areas of
público-privadas para el desarrollo infraestructura y la
specialization
empresa,
include public
relaciones entre
management,
empresas y gobiernos,
PPP,
inversión de impacto e
PPPs,
innovación
the
social.
relationship
Ella es
between
doctora en
companies
gestión
and
pública y
government,
profesora en gestión
and
pública y relaciones
analyzing the
gubernamentales y
impact
empresariales de la
of
Escuela de
projects in the
Gestión de la
social
Universidad de
and
Bocconi.
economic areas.
Y finalmente, don
She
Marco Siqueira.
also is one of
Él es
the
especialista senior del
professors at the
equipo de
Bocconi
asociaciones público-privadas del Banco
scholars at the
Interamericano de
Bocconi
Desarrollo.
University School of
Tiene una
Management.
amplia
And
experiencia
finally,
tanto
we'll
en su
have
país de origen,
Marco
que es Brasil,
Siqueira. He
así
is
como internacional en los bancos
senior
multilaterales,
specialist in
en la
PPPs for the
identificación,
IDB.
preparación y ejecución de contratos
He
de
has been
PP,
working in this
habiendo gerenciado
mul-
una cartera de más de 3.000
in
millones de
the
dólares en
preparation,
sectores como
in
transporte,
drafting
infraestructura
and
social,
structuring
energía y activos ambientales. Cuenta con un
PPP
bachiller en leyes y administración
projects
pública, así como un
for
grado
the
de
IDB.
maestría en
He
políticas
has a
públicas de la
bachelor's in
Universidad de
public
Sheffield, del
management
Reino
as well
Unido.
as a master's in public
Muchas gracias
policy from
por
the Sheffield
acompañarnos.
University
En
in
función del tiempo,
the
paso
UK. Thank you
a
for joining
formular
us
la
today.
primera pregunta a
In
don
the
Ernesto
interest of
López.
time, I'll give the
Y es la
floor
siguiente.
to
Perú ha
Mr.
realizado
Ernesto
enormes
Lopez to
avances
answer
con la
the first question.
incorporación
And the
de la
question
modalidad
is,
de contratos de
Peru
PP
has had
en sectores de infraestructura
significant progress
social,
in
agua,
terms of
saneamiento
the
y salud,
mobility of contracts,
además de
PPP,
desarrollar una creciente cartera de
for
proyectos.
water,
El país ha
sanitation,
buscado
and
por
health,
exigir
in
un nivel de
addition
calidad
to
al beneficio de los
increasing
usuarios
its
a
portfolio in
través de
this
su gestión de
regard.
contratos.
The country
En
has
este
been looking to
contexto,
benefit the
¿cuáles han sido los
users
factores clave
uh,
para garantizar un
based on
buen
the
servicio a los
contracts
usuarios y
that
cómo
have
continúa
been
el país trabajando
drafted?
para
So
mantener
what would
y
be
mejorar los
the
estándares?
measures to ensure good
Adelante, don
service for
Ernesto.
users? And how can the country
Muchas
continue to
gracias,
improve
muy
its
buenos días,
standards in
buenas
this
tardes a
regard? Well, thank
todos los
you.
participantes en este
Good
congreso
afternoon,
y
good morning
muchas
to
gracias por la
all
invitación también para poder
participants that are joining us in
participar,
this Congress,
extendiéndoles el
and
saludo de
thank you
nuestra economía y
for
finanzas.
allowing us
Eh,
to participate
Efectivamente, en materia
from the Ministry of
en
Economy and
materia de
Finance.
salud, nosotros ya contamos
As a matter of fact,
con algunas
in
experiencias,
terms of
¿sí?
health, we
Hay una
already
serie de
have some
proyectos que actualmente se
experiences.
encuentran en operación, proyectos
There
de
is a
APP en
series
salud
of
que se encuentran
projects that
en
are
operación.
currently
Por
under
ejemplo, tenemos
operations like the ones
el
for
Hospital 3 del
APP and
Callao
health,
con
PPP projects in
un monto
health,
de inversión de 57
Hospital 3 in
millones de
Callao,
dólares. El Hospital 3
where
de Villa
the
María del Triunfo con
investment
58
amount is
millones de
$57
dólares de
million.
inversión. Un servicio de gestión y
Hospital in
almacenamiento,
Trufo with
distribución y
$58
entrega de
million
materiales a la red de
worth of
almacenes y
investment,
farmacias de Lima de salud,
one
del
service
administrador
for
de la
the
Seguridad Social en
management, the
Salud
storage, and
de Perú,
distribution
por un
of
monto de inversión de
materials
16 millones de dólares. Y el
for
proyecto
the
Torre Treca,
health
que es
facilities in Peru for
un nuevo
$27 million,
establecimiento de salud en
and
el centro de la ciudad, con un monto de inversión por 51
a
millones de
new
dólares.
health
Además
facility
de
in
estos proyectos a cargo de
for
salud, tenemos también el
$151
Ministerio de Salud con un proyecto
million.
de gestión
In addition to
del
those,
Instituto
we
Nacional
have
de
the
Salud
Ministry
del
of
Niño,
Health
suscrito en
with
el
a
año
project for
2014. Es
management
decir, y
of
en estos proyectos
children's
nosotros
health
contamos con
services.
tanto la
And in all
modalidad
these
de
projects,
bata
we
blanca, ¿no?
have
Que comprende
both
incluso
the
los
white
servicios
robe
asistenciales para
modality,
el caso de
which
los hospitales
includes the
que están a
fundamental
cargo de
services,
salud,
such as the
como
ones for
también proyectos de
the
bata
services
verde,
for
como el
hospitals,
proyecto del Ministerio de Salud
and
y
also the green robe
nuevo proyecto
hospitals,
de la Torre
which are
Treca.
delivered by or led
Adicionalmente, se
by the
espera
Ministry of
adjudicar
Health,
dos
and
proyectos
the project for
bajo
the
APP
Trek
de bata
Tower.
verde, que son
We are
hospitales de
looking to
alta
implement
complejidad
two
en las
projects,
ciudades de Chimbote
green
y
robe
de Piura.
projects,
Entonces, como digo, hay una cierta
in the cities
experiencia
of Chimbote
y
and
acá
Piura. So
creo que es
there is
importante
an accumulated experience, as you can see. And I think it's important to mention that one of the elements that we have included in the design for our contracts is the mechanism of payment based on availability. So that means that the payments to the concessionaires will initiate not because of the progress and the works, but as a mechanism where the payments will begin once the infrastructure is put into operations and begins rendering services to the community. Also, we have had some developments in terms of the regulatory frameworks. During this year, we have updated our regulations for the PPP. And as part of the elements that have been incorporated, we have incorporated the sustainability principles precisely as part of the vision of the IDB for 4 pillars for sustainability, that is financial, institutional, environmental, and social. We have also moved forward in terms of the competencies and the interactive approach so that we can make evaluation processes more agile, looking at private investment projects and trying to eliminate some phases for reviews and trying to address what are different subjects that pertain to the different agencies. Also, we have tried to simplify the process. And finally, we have introduced the mandatory implementation of specialized bodies for the project management and project delivery. This is pertaining to the PMOs that will have to be used in projects that are above a certain threshold so that they can then benefit from certain incentives that are out there for these projects. Thank you. There's another question for Veronica. In the context of the performance review for the infrastructures, it seems to be at its beginning. What do you think that would be the impact of that in contracts?
Yeah, thanks very much for the invitation. And I'm very sorry if I'm speaking in English. Actually, I can follow you talking in Spanish, but I prefer to go on in English. I would like to bring you the European perspective, so not just the perspective of Italy. As you know, in Europe, many countries use the PPP for not just for economic infrastructure, but also for social infrastructure. And Italy, UK, and Spain have used the PPP for building, for developing a quite extensive network of hospitals. Actually, the model that we followed is the UK traditional model, with many non-core services included in such contracts. These contracts, however, were mainly bundled traditional contracts with a big label on top that called them public-private partnerships. So this is the issue that we have got. We were a forerunner in this, and actually PPP was mainly used for macroeconomic goals rather than for strategic goals or to have more efficient services. Actually, in the UK back in 2012, but also in Italy, we decided to move towards the so-called light PPP, especially when the goal was and is to build new hospitals. In a light PPP, we include just the design, the building, and the management of those facility management services that are strictly related to the building, such as maintenance and energy management. I can absolutely understand that for emerging markets, it is important to introduce also in such contract non-core services in order to deliver more quality. My suggestion for you is that, first of all, it is extremely important to make sure that KPIs are very well set within contracts, and such KPIs, of course, should ensure a certain degree of quality, but also make sure that if you increase quite a lot the KPIs and also the risk allocation upon the concessionaire, the cost for such services is also higher. Furthermore, it is very important not just to apply the standard penalties that in general we apply for traditional procurement, but it is important to apply deduction. Okay, so deduction increase the level of incentives upon the concessionaire. Finally, it is very, very important to use benchmark or market tests, because what we are experiencing right now, especially for contracts that we signed 10 or 15 years back, is that the quality of such services included in PPP contracts is lower than the quality and the innovation that we can get with standard traditional contract, because of course we have new technologies, we have digitalization. So remember that such contracts are rigid. Okay, the length of such contract is more than 20 years. So when you embed non-core services, it is important that you also include the flexibility clauses, such as a market test, and not just to check the cost of such services on the market after 3 or 5 years, but also the level of quality. So this is in a nutshell my experience, and then of course if you want more insights, I'm here.
Okay, thank you very much, Veronica. It's very interesting, the presentation, because it's some of the topics that we are discussing in the region. A continuación, quisiera hacer una pregunta a don Marcos Siqueira.
I would like to ask a question to Marcos Siqueira. Yeah. Marcos.
En base a tu amplia experiencia,
based on your broad experience in Brazil in structuring projects in the social sector, just like parks or prisons or schools, what are the cross-cutting practices that you can adapt from the infrastructure sector into the public sector?
Marco, estás en mute.
En mute, como siempre, ¿verdad? Nuestra vida. Gracias a todos. Gracias,
well, thank you, Ignacio. And congratulations for the previous presentations. It's very, very interesting to be part of this debate. But you know what, listening to Ernesto and to Veronica, and having heard José Manuel's presentation, I have a feeling that the core of the problem lies with the design of proper incentives for the agencies that provide the services. And the issue of incentives is not new for administration. I remember what Woodrow Wilson said over 100 years ago in a paper where he discusses how to design incentives for the agencies that are responsible for implementing the services. So I go back to the essential traits of the program, which is the fact that it is much easier to design incentives when the contracts or the way in which the service or the work will be implemented through a long-term contract than when the implementation model includes public officers carrying out the service. So, a traditional public works, you have a basic contract for construction, and then you are directly responsible for the execution of the contract, and it's very difficult to implement incentives there because you cannot just increase the salary or reduce the salary of public officers. So the huge innovation that APPs allow, or what we have learned from PPPs is that we need to promote adequate incentives based on performance. So we need to evaluate risks. We need to also define payment mechanisms, payment per availability. And I think that our next step in Peru would be to turn to payments per availability. That means if there's no availability, there's no payment. So we are learning how to promote those incentives, and for me, that is the crux of the matter. But in answering your question, Ignacio, the cross-cutting topic, regardless of whether it is a traditional public work or PPT, is that we need to consciously design the contractual mechanisms to align the incentives. And while it may seem obvious, it is anything but. The Latin America procurement tradition is very strongly focused on regulating processes, regulating inputs, which makes the inclusion of incentives really difficult, regardless of the mechanism that they intend to use. It is very complicated. So PPPs are bringing a revolution to our continent and to our countries. This is a revolution. The people from Colombia, from Uruguay, from Brazil can see that it is possible to design contracts where the description of the process is not at the heart of a contract, but rather the heart of a contract is a set of incentives so that the entity that is responsible for building the highway would be just as interested as the users or the government. So that is the revolution with PPPs. The next stage is because we will continue to build infrastructure in Latin America. We need to transfer the technology to traditional public works. I remember that in Brazil, in Cáceres, we worked in this of a project with a follow-up, and it was very, very interesting with the prisons in Brazil. And then the result monitoring system began to be applied to public prisons. And of course, you don't have the same incentives because then you don't have, there's no, you cannot just recover the investment. I mean, the people are there with the same salary and everything. But what we did gain was at least a point of comparison of performance. So to the extent that we learn to have performance or incentives by performance or linked to performance, then it will help us too with the public works. I am convinced today that Latin
de cómo introducir esos mecanismos contractuales
America
para que los
needs
contratos
to
públicos, sea
learn
por medio
how
de
to
inversión
include
privada, sea
those
por medio
contractual mechanisms
de otra
so
forma,
that public works, whether
buscando
traditional
los mejores
or
incentivos
through
posibles. Soy muy
PPPs,
optimista
will
y
seek
gustaría ver
for the best
Ernesto, que está ahí con las
investments. And I
manos
am an
en los contratos,
optimist,
está de
but I
acuerdo
would
conmigo
like
o no.
to hear from Ernesto if he agrees with me or not.
Ok. Bueno, ahí Marco planteó una
Well,
pregunta para Ernesto.
Marcos
Quisiera
asked a
complementarla en todo caso,
question
Ernesto, si tiene
for
la libertad
Ernesto, and I would
igual
like
siéntete libre para comentar los elementos
to
adicionales que
add
surjan como
on what
interesantes,
he
porque
said,
básicamente
and
en la
please
medida
feel
que vamos
free to
conversando también van surgiendo tópicos que uno puede tener interés
feel
de
free to add
revisar.
anything
En
that
esta
you think
perspectiva, digamos,
that we
respecto de
need
los
to
comentarios
hear,
que puedas
Ernesto.
hacer,
So,
¿cuáles son las lecciones
what
de la
are
experiencia en el Perú?
the lessons
Básicamente respecto a la
from
definición y
Peru
gestión de indicadores para poder evaluar
regarding
el estado, evolución o impacto de los
performance
servicios
indicators
en el
to
ámbito de la justicia
evaluate
social?
the impact of the services
Bien,
or the social
gracias.
impact of services?
Bueno, quiero coincidir en buena medida con bueno, bastante de lo que ha
I
mencionado Marcos, ¿no?
agree mostly with
Definitivamente,
what Marcos has said.
Es significativamente más difícil
I think that it is
poder
significantly
plantear incentivos en el
more
caso
complicated
de
to
los proyectos bajo una procura pública, una contratación
have
convencional. ¿Sí?
incentives
Pero
in a
también creo
traditional
que es importante
public
tener en
work.
cuenta que
But it is also important
especialmente en el caso
to
de la contratación convencional,
know that in the case of
lamentablemente no estamos solamente hablando de una necesidad de diseñar los
traditional public
incentivos
works,
adecuados, sino que
it is not only
inclusive
about
hay
designing the
situaciones en las
right
cuales tenemos que dar
incentives.
un paso más
There
atrás
are
y
situations where
preguntarnos
we
por el
have
estatus de las
to
capacidades
step back and
del
actually
personal que
look
está a
at the
cargo
capacity and
de estos procesos,
of
¿no es cierto?
people who
Entonces
are
creo
in
que va
charge
de la mano
of the
con un
process.
tema de
So this goes hand in
diseño de
hand
incentivos,
with
sí, pero también creo que hay
designing
que
the
prestar
incentives,
atención
but
a un
we
tema
also have to
de fortalecimiento de
look at
capacidades para una
building
mejor comprensión, digamos,
capacities
cuál es
for
la necesidad y
a better
las
understanding
ventajas de poder contar con
and the
algunos
needs of
algunos de los mecanismos
having
innovadores que
some
se
of the
proponen,
innovative
¿no? Por
mechanisms
ejemplo,
that are being proposed.
hablábamos nosotros de el mecanismo de pago por
We
disponibilidad
spoke about
y es sorprendente, digamos,
payment
cómo,
per availability,
digamos,
and it
lo
is
resistido que ha podido ser en
surprising
algunas situaciones este mecanismo, ¿no?
how
Porque
much people resist this mechanism, because
en el caso de algunas entidades, digamos, existía una costumbre de poder trabajar, digamos, bajo un enfoque más tradicional de pago por hitos de
view
avance de obra,
of
¿no?
to
Y había un
working
argumento de costos,
according
¿no? Es
to
decir,
payment
nos resulta
by
más
milestones.
barato
So there
poder
was an argument about
remunerar
the
la inversión de
cost.
esta
They said
manera.
it is
Pero
easier
obviamente
to
se
pay
estaba
by
dejando de
milestone
lado que no
down
estamos
than by
contratando lo mismo,
availability.
sino
And then
que
we
bajo el
needed to make
esquema de
it very
pago por
clear
disponibilidad
that we
estamos
were not
contratando también
that this was
ese
not the same
alineamiento de
contract.
incentivos
Payment
para
per
que
availability
el
is
sector privado
having
pueda
incentives aligned
efectivamente
so
asegurar de la
that
manera más
the
eficiente
private
posible la
partner
obtención
can
de los
ensure
resultados, ¿no? Entonces,
that the outcomes will
hay que prestar atención a
be
ese
obtained.
elemento de las,
So we need
de las
to
capacidades,
pay attention
también.
to the issue of capacity building.
Can I add that I fully
Sure.
agree because I would like you to suggest a great attention. Of course, I'm absolutely pro PPP, so I do believe that it is a powerful mechanism, not just to deliver off-balance sheet investments and to raise private money, but mainly to achieve strategic goals. So if the idea is to push innovations through PPP, I do agree that this is absolutely the right approach. However, the same public employees that design a PPP contract should be able to design also a traditional procurement contract. So I really suggest you to adopt an agnostic approach to the PPP, meaning that, of course, it is not a model for any season. It is important to carefully understand where we can apply it and under which conditions we can use the PPP. What we see in Europe is that a certain kind of innovation can be achieved also through a traditional procurement. What we need is a change in the public sector approach. So the public sector should move to a strategic buyer approach, meaning that the public sector should be able to purchase from the private sector to stimulate the innovation in the in the private sector, irrespective the model adopted. In Europe, for example, nowadays, since 2014, it is clear under regulatory perspective the difference between a concession contract, meaning a PPP, and a traditional procurement. And the main distinction is in the allocation of the operation risk that could be due to demand fluctuation or to supply fluctuation. For example, the delivery of the availability of a project, the availability of services, etc., etc. Another final suggestion is the importance to move from a value for money perspective into a value for society perspective, a more holistic approach to decide which kind of contract to use. Because in Europe, we have adopted a value for money perspective, just looking at the cost for the public sector and not, and we did not look at the effect on the society. And this is also something very important. And also value for society analysis should not necessarily be quantitative analysis, because if we don't have data, and I think that you are in the same situation like Europe, many often we don't have a precise data to compare. Of course, in such situations, biased decisions may occur.
Mira, una de las reflexiones que teníamos cuando estaba trabajando el equipo
One of the things that we were thinking when we with José Manuel, when we were working on the study, was the approach, as Veronica mentioned. So are we comparing two completely different things? But the spirit here is, what are the contract options for the government to purchase a service? Do we have a traditional procurement, or do we have PPPs? Because, I mean, in strict sense, a PPP is still public because it is financed with public funds. So then I would like to ask, what do you, what have been your experiences in finding a common core? You know, when how do we have to train our public officers on learn? Whether do they have a common core and then decide which contract to apply? What is your experience in Europe? What I remember is the UK, in the NHS, they had schedules, they had standard schedules or standard, like a template contract that they would apply to both PPPs or traditional contracts. So what would be the things that you would consider as a common core? Because in Latin America, we're still operating as two different worlds. What would be the common core?
Yeah, I think that, of course, it is very well. It is very important to train to train public employees, especially in performance management, in contract design, in also understanding the features of the markets. Unfortunately, in many European countries, there's a dominant legal approach when it comes to public procurement and PPP. And so many mistakes were done because of a lack of specific competencies in public management, performance management, financial analysis, and so on and so forth. In my opinion, again, it is extremely important to also to innovate traditional procurement. So I think that a collaborative approach with the market is possible also with a traditional procurement, because in some cases the standard penalties are just okay to incentivize quality. What is very important is the contract design and the selection of the right private operator. However, again, my suggestion is to invest in skills. According to a recent study that I published, we proved that more skilled employees, public employees, are able to reduce the moral hazard situations, and therefore the renegotiation of a PPP contract and the traditional procurement contract. But again, public management skills and not just the legal skills that have been dominant in the public sector. Again, I really suggest you to have an agnostic approach, because of course, when it comes to building something, PPP can be useful. But just to give you another example, as of now in Italy, we have decided to use the traditional approach to build the main hospitals and to move to PPP just for very innovative services, technologies. So smaller contracts are very much focused on innovation and also shorter contracts. So this is, for example, what we decided to do, also based on the evidences of my research, for example.
Okay. Muchas gracias, Verónica.
Thank you very much, Veronica. That's very interesting. And just in closing, I would like to ask for a final comment to Marco as to what is the role that the banks play.
Adelante, Marco.
Go ahead, Marco.
Estás en mute.
You're on mute. Unmute your microphone.
I'll just speak in English just to engage a little bit with Veronica, if you allow me directly. It's just to say that of course, traditional procurement can be modernized, and PPPs have lots to teach. Can use, if not indicator performance like type of contracting, resulted oriented. You can introduce that, and that can have a huge impact. But one thing that cannot be done through modernizing traditional procurement is to include the private financing side of it. Yeah. And introducing the private financing side of it changed the game, because that pushes the incentives to a whole nother level to say, you've built this $500 million hospital here. If you don't deliver, you don't get your money back.
Yeah, absolutely.
It's a whole new game. It's a whole new ball game.
Yeah, absolutely. But I absolutely pro PPP. What I'm saying is just to make a PPP contract lighter. Okay, so I'm not a fan of very large and very complex PPP schemes with a lot of non-core services included. Okay, so that's my position. And availability charge, very straight, very focused. And then just let me add one thing. So for example, I really like a big PPP contract for building the hospital and just maintain the hospital. Then you want new technologies, you can make a smaller PPP for such new technologies, because sometimes we have the idea that if we group many things is the right approach, but it is important that the public sector can maintain the control. They need to control and to govern the contract.
Yeah. The metaphor I like to use is that the private sector should be the boat motor, whereas the government should keep the control of the direction at all times. That requires flexibility. It's hard to do, but one thing that we've been learning in Latin America is how to do it. So I think that's the key. But sorry, Ignacio, just going back to your question, I think, and in this discussion, multilaterals have key roles. Let me just point one out of time, which is we are very privileged in being able to learn from Ernesto, learn from Veronica, learn from Bruno, who spoke earlier, and somehow bridge the knowledge gaps in which this technology of how to make the most of public contracting to deliver better results for the people that we attend. We are in a very privileged position. I think the more we do it, the more we'll be able to serve our countries better.
Okay, muchas gracias. Yo creo que la discusión recién comienza. La visión de
Thank you very much. I think that Veronica's vision is shared by the people from the banking industry. We developed this mixed discussion, and considering what Marco said, incentives, of course, are different. Thank you very much to everybody.